All right, Jamie, thank you. Breakthroughs in blood cancer research are being tested in clinical trials for other cancers and diseases, including brain, breast, kidney, liver, lung, ovarian, pancreatic, and prostate cancer, as well as multiple sclerosis and diabetes. And this looks to be just the tip of the iceberg on how blood cancer research can provide game-changing treatments that benefit other cancer patients and save more lives. And joining us now, Dr. Louis DeGennaro is President and Chief Executive Officer of the Leukemia and Lymphoma Society, and Valerie Fiordialino-Maslow, who is a physician's assistant who has a personal story to tell about experiencing one of these drugs and how it impacted her life. We'll get to her story in a moment. But doctor, let me ask you first, how has blood cancer research gone beyond its scope to provide game-changing treatments for other diseases?
Hello, Dan. So it's a remarkable age for blood cancer patients and blood cancer treatments. In the last 2 years alone, the FDA has approved over 50 new treatments for the blood cancers. And what we really want to talk about here is how these treatments developed for blood cancers, leukemia, lymphoma, multiple myeloma, are paying benefit to patients with other forms of cancer and even other non-cancerous diseases. I'll give you one quick example. Among those FDA approvals was an amazing new treatment called CAR-T immunotherapy. It teaches the patient's own immune system to find and attack and eliminate the cancer. It's doing wonders for leukemia and lymphoma patients. Now it's being tested for breast cancer, colon cancer, prostate cancer, that long list that you gave. Just one example of how blood cancer research ports over to the treatment of other cancers.
Yeah, and Valerie, I guess you're happy that that research has proven that it can be an opportunity to treat other diseases. How has that research changed your life?
So when I was 27, I got diagnosed with a form of MS called relapsing remitting multiple sclerosis. And at the time, I didn't have a lot of great treatment options. But just in the last few years, there's been an exponential rise in amazing new treatments and therapies for this disease. And one treatment in particular that was just recently approved in the last couple of years for MS was actually initially developed and indicated for blood cancer patients. So I received this therapy 2 years ago, and I just received the booster last year. Ironically, this exact same treatment that was initially for blood cancer was a therapy that my father received over a decade ago for treatment of his chronic lymphocytic leukemia. So it's pretty remarkable that a blood cancer therapy that was once developed and treated in my own father's disease has now been transformed and is now being used for an entirely different disease altogether, and has essentially put my MS into remission.
That's awesome. Well, we wish you the very best, Valerie. Thankful for these medical discoveries, certainly, of how one medicine can treat another disease or another blood illness. Thank you so much, both, for being with us. We appreciate your time and information, and have a great day. Several stories still ahead.